Morgan Castle, and this is my abdominal exam. So first you start by inspecting the abdomen. You look for skin symmetry, any abnormalities, any bulging. Her skin is symmetric. She does not have any abnormalities. There are some scars present from previous gastric bypass. And then we'll start by auscultating. Her vowel sounds are hyperactive in all 4 quadrants. And then I will auscultate the arteries, starting with the aortic. There is no bruit in the aortic artery. And then renal. No bruit heard in the renal arteries. And then iliac. No bruit in the iliac arteries, and then the femoral. And there is no bruit in the femoral arteries. And then auscultate for venous hums. So at first you go to the liver. There are no venous hums heard over the liver. And then also the kidneys. Or not the kidneys, the spleen. No venous hum heard over the spleen. So then I will percuss her abdomen. Let me know if any of this is tender. There is tympany throughout. And then measure the liver size. Her liver is about 6 centimeters, which is a normal finding. And then we'll check the size of the spleen for splenomegaly. There is tympany throughout. So then we're going to go to palpation, okay? I'm going to start with light palpation. Let me know if any of this is tender.
No.
Okay, and then we're going to go deeper.
Ow.
Any tenderness? So there is no tenderness upon palpation. If it was positive, you would test for rebound tenderness, but hers was negative. So the liver was also not palpable, and then the spleen was also not palpable. And then you palpate the kidneys. Sorry, I know that's a ticklish spot for you. And the kidneys are not palpable. Then you would measure the aortic width, but I do not have a thing to measure it. So then I'll have you sit up and I'll test for CVA. Let me know if this hurts at all.
No. No.
Okay. She is negative for CVA. So then I'll test for ascites. What's your shirt back there? And this is where you listen for tympany to dullness. and there is tympany throughout, so there is no ascites. So you can also test for appendicitis. That's where you check the Rovsing sign. You press on the left side, and if that can cause pain to the right. If that's positive, you press on the knee and have them bring it up and in, and that will also cause pain in the right lower quadrant, to test for any appendicitis or any abnormalities within the appendix. And then the Murphy sign, you palpate over the liver. Have them take a deep breath. And if that's not painful, then that is a negative Murphy sign. So that concludes my abdominal exam.